Hi, I'm Kaylee. I'm going to be your nurse today. Do you mind confirming your name and your birthday for me?
Lindsay Maringer, 6/1999.
Awesome. Write my name up here on the board just in case you need to get a hold of me later. Can you tell me today's date, Lindsay?
11/12/19.
What brings you in here today?
I just need a few assessments done.
Okay, alright. Well, today we're just going to do a little bit of a neurological assessment. Shouldn't be invasive or anything. I'm just going to ask you a few questions, poke and prod for a little bit. Just looking at my patient, I can tell that she's conscious, alert, and oriented. She doesn't seem distressed in any way. She was able to make good eye contact. Her hygiene looks good. Her grooming looks good. She was able to make a logical conversation, so I don't see any need for a further health assessment. Her airway doesn't seem obstructed. Her breathing's nice and normal, not labored, and her circulation seems good, so I don't see any cyanosis or pallor. I would check her vital signs and her heart rate, and then first off, we're going to start off by just asking you a few questions. So, have you had any head injury or muscular injuries in your recent past?
No.
Have you had any neurological illnesses or symptoms?
No.
Have you felt confused or had headaches or anything?
No.
Experienced vertigo or seizures?
Mm-mm.
Difficulty swallowing?
No.
Have you been able to talk okay?
Yep.
Can you swallow for me? Alrighty, and have you had any lack of coordination, or has your family noticed anything?
Nope.
Alright, well, I already did take a look at her mental health assessment, and like I said, that looks good. Her hygiene looks good, grooming, her speech patterns are normal, her facial expressions are expected, and I don't see any drooping of the mouth or eyelids. Looking at her, I would rate her a 4 on the Glasgow Coma scale because she was able to open her eyes when I needed her to. Can I see her fingers? Does that hurt?
Oh, yeah.
Okay, good. So then I would give her a 6 because she was able to tell me that her on her motor response, and she was oriented to the time, place, and where are you at today?
Hospital.
Alright, so I would rate her a 5 on that scale. I would take my pen light and I would look at her pupils. They dilate when they need to. You mind following my finger? They accommodate when they need to. Her pupils are a normal size and they're nice, even, round, and symmetrical. She can get up at her own liberty, and she doesn't have any assistive devices or need anybody to help her get up. She's not a fall risk, so I would not set her bed alarm on. And she has full weight bearing status, so I don't see an issue or the need to put on any socks for her. Once again, she does not have any assistive devices, nor does she need any. Do you mind setting up for me and swinging your feet around? She's able to sit up on her own. And I would say that she is normal. I don't see any signs of weakness or anything in her movements. Do you mind standing up for me? Can you take 5 steps this way? And take 5 steps that way? And can you walk towards me on your toes, please? And then walk that way on your heels, please. So the patient's gait and balance is really good, and so is her coordination. Next, I'm just going to have you come a little closer and close your eyes. Alright, good. So the patient didn't have any abnormal amount of swaying, so that her romper test looks good. Do you mind turning around for me? Bending over a little bit. Her spine is nice and in the back. I don't feel any masses or deformities, so I don't see any signs of cyanosis, so that all looks good. Can you move from side to side for me? Can you touch your toes? Can you go all the way back? Alright, good. So that range of motion's nice and normal. Does that give you any pain or stiffness when you do that?
No.
Alright, and then you can sit down if you would like. Alright, next I'm just going to look at your arms and your hands. Can you lift up against me? And then try to come down against me. And on your hands, try to push down. And up, try to come up. Alright, those look good. Does that cause you any pain at all?
No.
Alrighty, and then I'm just going to palpate your upper extremities. Does this hurt you at all? I don't feel any swelling or abnormalities and or bulges. Next, I'm just going to test your muscular strength. Do you mind pushing up on your shoulders for me? Alright, those look good. Next, I'm just going to, will you mind going like this for me? Alright, her finger coordination's good, and you tap your nose and then tap my finger. And that coordination is also intact as well. For your shoulders, do you mind going here, come back down, and then bring it in over here, other side, and then all the way back. Alright, looks good. She's in that full range of motion. her shoulders. Next, I'm gonna look at her feet and her legs. Palpating, I don't feel any deformities or abnormalities. Her knees doesn't seem to have any swelling. Do you mind trying to lift up against my legs? And then, do you mind standing up for me again? Will you go like this? And then that's her flexing's good. Put it back down. Her extension's good. And then next, we're gonna look at your hips. So do you mind just putting your legs straight forward, all the way back, bringing it inwards, bringing it outwards. All right, those look good. So her range of motions, nice and good in her knee and hip range. Did that cause you any pain or stiffness when you did that? You can release it back down for me, please. Next, I'm gonna just test her ankles. So do you mind like trying to push it up against me and down, and then move your ankle inwards and then outwards. So her inversion, exversion, range of motion are intact for those. She's able to abduct and adduct. And then, I'm sorry, do you mind sitting up for me one more time? And do you mind just doing like this with your ankle? Alright, those look good. You should have no trouble standing. Next, I'm just going to test some of your sensation. So just tell me where I'm touching it.
My left hip. My fucking. My chin. My nose. No, my knee. My leg. My ankle.
Alright, so all of her sensations are intact and she could feel where I was touching her. So do you mind flexing your arm for me? Extending it, going inwards, outwards. That range of motion is also intact. And then next I'm just going to do your reflexes. So I'm going to start off by, right here, just relax. Okay, that looked good. That one looks good. And then just relax your arm. Look that way for me. Alright, and that looks good. Alright, and then just kind of scoot back on the bed and hang your legs out for me. Relax your knees. Those both looked really good. And then next I touch your ankle. Right, and those both looked good, and then I would take her Babinski reflex. But today she didn't have any reaction, which is normal. So all of her reflexes looked really good. Next I would just make sure that the patient knows she can get comfortable. The call light, the red button's how you get a hold of me, and the rest of the buttons is how you use the TV. Put the bed in the lowest position. Put both sides of the bed rails up, declutter the desk, and put it next to her. Is there anything else I can get you today?
Nope, I'm good.
All right, and I would report her findings on the chart and let the doctor know. Thank you.